At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Combining Eastern and Western Medicine on Wednesday, June 29th at 7 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. That's rosellecare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Welcome to Dr. Tom Roselle Live. This is Dr. Tom Roselle. Indeed, I am live with a really interesting program for you today. Hopefully you're enjoying the day and out and with your families and friends and doing the things that you like to do. But you know what? What's very important is that you pay attention to what we have to talk about, because it's kind of taking the shade off of the blend, if you will, between allopathic medicine, which we lovingly call Western medicine, and Eastern medicine, which we call traditional Chinese medicine. And we're going to kind of blend the two today and tell you what the differences are and what the commonalities are. There's so many different commonalities when you take a look at it. To start it out, the difference is that, for me, when you look at Eastern medicine or traditional Chinese medicine, it really asks the question why something exists. Well, allopathic medicine or Western medicine gives you fundamental factual information that now is left to discretion, if you will. But who better than my dear friend, Dr. Qinglong Zhang, to talk about this, a man who I have tremendous admiration for, the guy who is, from Shanghai, China, and is a doctor of traditional Chinese medicine, as well as a physician in this country as well. Dr. Zhang, welcome.
Hi, Dr. Roselle. Hi, Dr. Roselle. Hi, everybody in front of the radio.
This is a fun program to talk about, because you and I talk about it virtually all the time in the office.
All the time.
When it comes to, how are we going to look at this patient? What's the differences? What is the discretion and so forth? So let's begin to walk into it a little bit, and it will help people regardless of the diagnosis. In Western medicine, diagnosis is based so many times just on the symptom presentation. And not on what's really going on. But let's talk about what's the underlying philosophy, if you will, of Chinese medicine, so people understand that. Then we'll move into how that compares to Western medicine.
Yeah. So, before we just very briefly talk about my bio, if you don't mind.
No,
so I was born in medical doctor family. My father, my older brother, my sister-in-law, all pure Western medicine doctor. So I'm the only one. I studied both, actually. When I was in China, I was doctor there for 5 years. I was practicing for both Chinese and Eastern medicine and Western medicine, actually. So my hospital is a very big hospital called Shanghai Shuguang Hospital. They combine the Western and Eastern medicine together. So that's why. So I like this topic. I like I like to combine different things together to treat a patient. So speaking of philosophy, Chinese medicine has been there for 1,000 years. So Chinese medicine not only medicine, not only for treatment, but for a lot of philosophy. So, for example, when I was in the Chinese medicine school, when I was in China, so the Qigong, Taiji is a part of your medicine, you have to learn. It's required for your courses, for classes. And that means Chinese medicine based upon Chinese philosophy. So when we talk about Chinese philosophy, we talk Confucius, we talk Dao, we call the Confucius. So Chinese medicine borrow them to combine with medicine together and then develop a Chinese medicine.
I want for our listeners, as you go through, and this is fascinating to me, and I find myself listening to you because I understand the background. But for our listeners that don't understand the background, I want to give them a couple definitions, if you will. You mentioned, the philosophy of Qigong and Taiji and so forth. What I want our listeners to understand is what is what Dr. Zhang is talking about is the energy of the body, the energy movement of the body. Those are different applications, and to understand really how the body works interconnectively. And today in Western medicine, we're finally catching up to the East, but we're doing it from understanding how the cellular elements, the energy that the cells produce and the atoms produce within the body have such a great impact. But going back thousands of years, your initial input, your philosophy embraces that to begin with.
Yes. So thank you for the more detailed explanation. Yes. So everything based on energy flow on the 5 elements. We talk about 5 elements: the wood, fire, and the metal, the water, and all these 5 elements, and also we talk about yin and yang. So this all the methods, all the philosophy to combine together to develop the Chinese medicine.
So I'm going to do it again too, unfortunately. So it's a tremendous, a lot of information to take for the Western mind. So when you're talking about, and I'm going to say it in a Western term, yin and yang, what that is I want people to understand that it's the opposites of things, the balances of things. For example, hot and cold, and night and day, and man and woman, and so forth. They're the opposites, but together they make a whole. They're blended. And so when you're looking at from a Chinese medicine point of view, you're looking at the imbalances that occur from one side to the other. And then the other piece that is fundamental that you and I understand when we talk about 5 elements of wood and fire and metal and water and so forth, those are philosophical terms that have an input. And so what that means, for example, tell us how, that works. Yeah,
absolutely. So for example, elements, so the metal in Chinese medicine, in the if you compare to the body, metal related to the lung, wood related to the liver, water is kidney, fire is heart, earth and spleen. So these 5 elements, and they connect together. And for example, and wood produce fire, and the fire fire produce the earth. So they have the circle there to produce each other, and then they connected. So I'll just give you an example for the patient example. The patient cannot sleep well at night. How patient cannot sleep very well. They went to all different doctors there who check everything. The Western medicine doctor, they give her a lot of the medicine, or to calm her down, or nothing worked. And then when I check the patient, I use 5 elements to analyze the body. I said, your fire is too much fire. Your water is too less water. Your fire and water is not balanced each other in the body. That means the kidney and the heart not balance each other. Then you will never sleep well. This is from Chinese medicine side to analyze you. So this is also same thing. So the 5 elements, they have a lot of connections inside, not only just 5 elements there. So you have to know the connections too.
So we can complicate things, and we might touch upon it in the next part of the program when we start talking about the energy timing of the different elements of the body. So what we're talking about right now is that every organ system in the body is connected to every other organ system. And there's some organ systems enhance the capacity of another organ. Some organ systems control or slow down the other organ systems. So this is a beautiful thing with Eastern medicine, because you're actually looking at what may have caused something. I'll give for an example. We know that the lung and the large intestine are combined together in a balancing act. They're yin and yang, as you would say, or a positive and negative balance. And when we talk about yin, we're talking about, in Western medicine, we're talking about parasympathetic healing. We're talking about life-giving forms. So it's a dense organ. Without the liver, you're going to die. The heart is a yin organ. Without it, you die immediately. But it's the opposite, or not the opposite, but the balancing act are ones that are hollow organs, and they're sympathetic. They are explosive to the outside. For example, like the small intestine is a hollow organ. It empties to the outside through the intestinal tract, the large intestine as well. So here you have as I mentioned earlier, a yang and a yin, the large intestine and the lung. Somebody who's a smoker, for example, may not have lung cancer, but may end up with intestinal tract cancer or large intestine cancer.
Colon cancer, yes.
And somebody who has a bad gut, bad intestinal tract, could end up with lung cancer. So that's the differencing with Eastern and Western medicine, if you will. You're looking at the things that are coupled together, are compared together, but, to fix the lung, you may be treating the intestinal tract first. To fix the heart, you may fix the small intestine first.
Intestine.
But there's other elements as well, with the liver affecting the heart and so forth. I won't complicate that any more than I have already did. I have a lot of people probably sitting there shaking their head right now. But this coming Wednesday, you have the opportunity to ask Dr. Zhang all of these questions, because he's going to be presenting in our office at 7 p.m. as usual. Please join us. This is an opportunity that you will have to ask an expert, really. The 29th is Wednesday, 7 o'clock. You can register by simply going online at rosellecare.com and hit the button, register now, but make sure we have a way to contact you so we can confirm the class, or call simply 703-698-7117 and sign up that way. And if you'd like to ask him a question today, it's 888-630-9625. Give us a call, and we'll entertain your calls on the air today. Give us a jingle right now. Dr. Zhang, let's go on. We have a couple more minutes before the break.
Yes.
Define that a little bit more.
So Chinese medicine, when you talk about Chinese medicine has a lot different way to treat you. For example, the acupuncture is called acupuncture, the Chinese herb, and the cupping, the gua sha, or there's a lot different ways to choose to treat a patient. But however, when whatever you use, which way you use, whichever, this is all based upon energy flow. So when you talk about energy flow, a lot of people get confused, or what's the energy? I don't believe what energy says. But this is the way. Actually, Chinese medicine is experienced medicine. It's not based upon. Later on, we talk about the Western medicine. It's totally different the foundation. So Chinese medicine think, why are people alive? Why are people alive 1,000 years ago without any X-rays, without MRI, without lab work? Why are people alive? Because they found out every single organ in the body has their energy flow, specific energy flow in a specific pathway, which is called a meridian. So don't ask me how they found out meridian. It's channel meridian. Yeah. So please do not ask me what's the meridian, what's the channel. It's a lymphatic system, or it's a nerve system, or it's a vessel, or it's a vein, or arteries. Nobody knows in the whole world right now. Same thing again, Chinese medicine is experienced medicine. But however, it works for 1,000 years.
The interesting thing is that years and years ago, the Japanese studied what's called Rotoraku points. And they're points that start on the fingertips, right? And they actually injected radioisotope into the Rotoraku point. And they followed it, and they were able to trace many of the different pathways that we're talking about. Incredible mapping that took place. So there are things that are out there, but unfortunately, we leave it to discretion. We're coming up to a break. I want to get into this because this is, for me, it's such a wonderful, intuitive sense of how the body really works. And if our listeners are aware of it, they'll say, oh yeah, I really get that. I did that and this happened. But we're coming up to a break. My guest today, Dr. Qinglong Zhang, a master practitioner, in both areas of allopathic medicine and Chinese medicine. Don't go away. We'll be right back after some very important messages. Welcome back, everybody. Dr. Tom Roselle. You're listening to Dr. Tom Roselle Live. Fascinating program today with somebody who I have tremendous admiration for, both as a doctor par excellence. This guy is amazing, and also as a very dear friend and someone who's very close to my heart, Dr. Qinglong Zhang. And we're talking about the comparative between Western and Eastern medicine and the differentiation between the two. In the beginning of the program, we said that Western medicine focuses on symptom presentations and the controlling of the symptom process without really necessarily asking the question, why did it come about to begin with? In Eastern medicine, it's a philosophical approach of going through the weeds, if you will, to find out what really is causing the problem. And in the Western mind, sometimes that's very difficult to embrace. We talked about positive and negative. It's called yin and yang in the balancing between sympathetic and parasympathetic, and 5 elements. So Dr. Zhang, welcome back again. Let's get going a little bit more, because we could talk about this literally for hours. And for the Western mind, we've got to break it down piece by piece. And this Wednesday evening, the 29th, 7 p.m. at the Roselle Center for Healing in Fairfax, you're going to be going through this step by step by step. And we encourage anybody that really wants to understand it to be able to take pieces home and really get what's going on. This is an opportunity for you that many people will never have, and somebody who's brilliant. Dr. Zhang, let's talk a little bit about how one system controls the other in the body, and the difference that from your traditional background, and you said your father and your brother and your sister-in-law, right?
Yeah, sister-in-law, yes.
Are all medical doctors, and you're the guy that studied both. So let's talk about how that works within the body.
Yes, so Western medicine, based upon the microbiology or physiology, they only see, or at the same time, they try to save your life. They try to, boom, save your life down, a kill stage. But long term, actually Chinese medicine designed for prevention, for preventive care, and not for treatment. So the best doctor always tell you how to prevent something. So that's why, in the office, no matter who the patient come here, I will tell them what to do at home. A lot of tips there too. And also I try to explain what's the reason cause that. I'll give you an example. For example, the diabetes. So diabetes, HbA1c over 6.4, you get diabetic, then you went to doctor get metformin, get a lot of different, the Western medicine, the drugs, then your sugar goes down. But however, at the same time, not only because, it caused a lot of side effects, but long term, your spleen and your pancreas get so stressed out. So nobody care your spleen and stomach function, and then only focus your sugar and use a medicine to bring your sugar and then draw sugar down. Nobody care about your organ damage. Nobody care the side effects. So that's why we try to combine together. So there's a lot of different way to combine Western and Eastern medicine. I did ask my dad, and my dad asked the same question. I said, if you want to learn Chinese medicine, how you want to combine together? So this topic is very, 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 very difficult, very complicated topic, not only here, but in China too. Chinese people, Chinese doctor, all the different doctor, Western medicine doctor, Chinese medicine doctor, they spend a lot of time to combine together. What's the good points combine? So that's why when I was in China, so we have a lot of herb here too. So at the same time, when we give the patient the Western medicine, just like the drugs, and then at the same time, we will always give some patient the Chinese herb to support the organ, to support the organ damage, to support organ function. So we do not want to put a fire or put too much water, put a fire that causes water damage. So we always try to find different way. That's why we combine together. So it sounds like, it's easy to combine together. But however, the point, you want to find the point, that's not easy. So that means, we have to find all the connections from the reason, from the cause, from the root, and then to do that.
We can even talk about later on in the next part of the program, there's a clock, an acupuncture clock. We call it the Horay cycle, H-O-A-R-Y. And what it does is it tells a story of when the different organ systems have the highest energies throughout the day. And in Chinese medicine, there are 12 primary channels or meridians, and each one of them have a 2-hour peak. So the symptoms that might be associated with that organ are going to be the most severe during that 2-hour peak. And we're going to talk a little bit about that as we come back into the second part of the program. It's very interesting, and if we really understood it and applied it properly, there's so much that we could understand individually and say, hey, I have a problem. I better get my act cleaned up a little bit, instead of just looking at the symptom. The symptoms don't show up until sometimes it's too late. We're coming up to a break. You're listening to Dr. Zhang, a guy who I have such tremendous admiration for, looking into the balance between Eastern and Western medicine. Don't go away. We'll be right back after some very important messages.
Dr. Tom Roselle Live continues now on News Talk 105.9 WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live. Indeed, we are. And I'm having probably more fun than one person should ever be allowed to have, talking to somebody who I have tremendous respect and admiration for, Dr. Qinglong Zhang. He's a magician. He's a balancing act between Eastern and Western medicine. Those of you know him, those of you who've been treated by him know that this guy is just incredible. But, what we really need to understand is how this blends properly from the Eastern portion and the Western portion. And there's so much to learn in our application of what we do. We're in an area today in Western medicine of functional medicine or integrative therapeutics. And basically what that is what I've spent 45 years of my life doing is putting all the pieces of the puzzle together. But it steals from the philosophical basis of Eastern medicine, because they look at the energy pathways of the body, the neurological pathways of the body, the biochemical pathways of the body, the emotional set points of the body, and how it ultimately causes things to come about. Dr. Zhang, welcome back again.
Thank you.
Let's get into this a little bit deeper, if you will, but deeper,
Yes.
but in a way that we break it down piece by piece so people can understand it. Like I said, I could be here for hours with you and just pulling things out of your mind. But it's for our patients who don't have that philosophy or that access to you. This Wednesday night, they have the opportunity. They're going to be able to listen to you and learn from you, regardless of whether they have heart disease, whether they have cancer, whether they have diabetes, whether they have hormonal imbalances and so forth. There's very specific ways of understanding why that happens, and then in addition to that, what you can do about it. So let's talk about some of those things.
So nowadays, more and more people focus the body they want the body to heal the natural way. So that's why more and more people try to eat clean, eat better. They try organic, try natural, grass-fed, all these things. So I believe that people also believe the body is a self-controlled system. So if you had just like a cold, if you get a cold, even though you do not do nothing, you will get better for 7 days, 5 to 7 days. That's the body can heal themselves in a natural way. If you take some supplement, do treatment, you get better quicker. It still help your body to heal yourself. So if some people right now in front of the radio is listening to me right now, you always know after just your same with Dr. Roselle, when a just patient, we hear the sound or we think it's a very good adjustment, we always say thank you. Why? The patient asks me, why you thank me? I said, that's a good question, because I thank you because I thank your body cooperation. I thank your body response to my treatment, give you ability to gain your self-ability to heal yourself. So that's why. So then we talk about acupuncture, we talk about different time. So acupuncture channel, we talk about channel meridian, is the same thing right now because blended together right now. So the different, we have 12 meridians, and the different meridian flow the different time period mostly. So for example, most people have a bowel movement in the morning, about around probably 5 to 7 o'clock. Did anybody ask why?
Very few ask you that.
Huh? I'm sorry?
Very few people ask.
Right?
Why,
very few. So why? So I had a question before I learned Chinese medicine. I asked my dad. I don't know why I always have the bowel movement in the morning, not at night. Some at night, but most of it in the morning. My dad said, oh, this is your body. No, why? I said, okay. So when I go to Chinese medicine school, I know why, exactly why, because we talked about it before. So every organ has a specific time period in the time of day. In the morning, 5 to 7 in the morning is your large intestine, the energy go to peak. It goes to peak. That's why because too much energy there, then they push all the, you have your bowel movement, you clean yourself, detox yourself. That's why. So because that means if you do not have a good bowel movement in that time period, that means your gut, it gets problems
It's
there.
not working. One of the things that I'll tell patients all the time when they complain that they have digestive problems and they have bloating and so forth, I ask them one question. Is it worse at nighttime? Is it worse in the morning when you eat or at lunchtime when you eat? And they say, oh, no, it's always worse at night. I said, well, then you have a gallbladder problem and your liver's not working the way it's supposed to. So what do you mean? How do you know that? Because the liver energy, the gallbladder energy begins to get at the highest level starting at 11 o'clock.
Yeah.
To about 3 o'clock in the morning, right? And the combination of the two. So you're going to be bloated, you're going to be distended, you're not going to feel good. But as the thing is, it's not exact. As the energy gets closer to that channel, as it gets higher and higher and higher, the symptoms become more prevalent, more obvious.
So you can see all this kind of answer. You think, oh, wow, why that? Why that? Is from Western medicine, there's no virus. You're no virus, no bacteria, no parasites, you're fine. But however, what had happened at that time? So the Chinese medicine answer you already. So Chinese medicine designed from a natural way. For another example, the herb. I use a lot of Chinese herb too when I was in China here too. I like the herbs. I like the way they design because in Chinese medicine, the herb is most herb from the food. So I will probably do some tour, go to Chinese store to tell you guys a lot of Chinese vegetables actually is a Chinese herb too. So that's why we want to heal the body the naturally. However, that means when I was in China, I teach too. I teach students in the college too, college, my school. So because my hospital is affiliated to the college, so that's why we had all the interns come in. I'll tell them, okay, so Chinese medicine is wonderful. Chinese medicine, Eastern medicine is wonderful. It's beautiful. That's why I'm here. However, if I got a fracture and on the road, do not send me to a Chinese medicine doctor. Send me a Western medicine doctor to fix my fracture. So that's right. The way. Yeah, that's the way. So you had to find a way to come back together. Same thing again. The Chinese medicine is just a slow cooker. So Western medicine is a faster cooker. If something is very urgent, you want to do quickly, go to China in the Western medicine. Yes. If you want to cook it better, cook it from the inside, so long term, tastes better, you want to go to Chinese medicine.
It's interesting that you brought that relationship up because I've said for years that if I'm in a car accident and I'm bleeding, you don't want me. You want somebody who can put you back together and, transfuse you and do those things and save your life.
Exactly.
But if you have something that's chronic and it's been constant and it just doesn't go away and you're on all kinds of medicine, you don't want to go to another allopathic doctor. You want to come to somebody like you or me that we can find out where it's really coming from and heal those organ systems and bring them up slowly back to where they're supposed to be. What's the biggest problem, in your opinion, when somebody comes down with cancer, and we have many different cancers? We can say it's this condition or it's this condition, but in your from an Eastern point of view, why does cancer come about?
So cancer in Chinese medicine is no cancer. This word actually. So all the cancer we call which is a special word for the cancer. But however, we call some lump. It's not cancer. The main reason across the board, no matter which kind of cancer, the main reason is your qi and the blood stuck there. Just like your draining system, your sink draining system. If there's a clog there and they get a clog there, your water is not moving. Same as your body too. Your qi and the blood is not moving. Your energy is not moving. Circulation not moving. That's called the cancer. So the way we do not treat the cancer, but we just improve your qi and blood circulation, energy circulation.
So let me ask you a question.
Yes.
I understand that most disease processes are a result of excesses or deficiencies, too much or too little. And the body has a very difficult time adapting to those things. And when we deal with it just strictly from a conservative point of view, but now we're talking about energy flow. We're talking about blood stagnation, which in the Western mind really doesn't make a lot of sense. And the energy stagnation doesn't mean a lot of sense. But even in Western medicine today, in the advent of quantum physics, if you will, and understanding energy fields and how they affect the body and the electromagnetic paths and so forth, we begin to understand that if energy is too much, it can rupture something. It's like too much water going after the dam, right?
Yes. Yes.
Or if it's not enough rain, too little, then we're going to have a dryness and we're going to have desert and we're going to have the inability of things to grow.
You cannot handle anything.
So
just like go ahead.
The body has to be in balance.
Yes. Just for example, this is a very good example. I get a patient all the time. The patient said, okay, I want everything. I want to get a better tip overnight. Every single patient, actually the patient, I have a very specific training plan. Okay, the first 2 weeks we do this, the first 3 weeks do this, and then the following do they do more and more. The patient said, why you don't give me everything together? I want to get better tomorrow. I said, listen, so I want you to get better tomorrow too. So this, I have to say, that's why I'm a doctor. But however, your body cannot, you're so weak right now, you cannot handle that much. For example, I give a very common so that everything makes sense. It's a very small fire, right? You want a big wind, heavy wind, or small wind to come out, right? If you have, right now you're a small fire, if you have very strong wind, the fire will be gone, right? You want a small wind, slowly the fire go higher, then you can handle more. So that makes sense. It happens very common in Western medicine, the field too. So when I was in China, it means a lot of pure Western medicine doctor, for the severe the problem of the patient, they give the patient a lot of high dose treatment, the drugs, high dose everything. The patient get worse and worse. So then they try to see me. I said, oh, Dr. Zhang. So actually the patient, every drugs from the guidelines, everything, blah, 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 you're going to get better. So they give it to me. And then I told the doctor, say, okay, stop everything. And then we have a new plan, slowly, slow dose, gradually. So that's a way to the patient.
It's an interesting situation. The Western mind wants everything done yesterday. They want expediency. But
yes.
They don't realize that their lifestyle has what's really produced all of this, has brought them step by step closer to the brink of disaster. And,
yes.
And now they show the symptom. And as I said earlier in the program, symptoms are the last things to show up. And the first things, if it's treated properly, they can become less and go away. But that doesn't mean that the system has been resolved or the energy is returned and the body's in a balanced place. So we have to understand that the body will resolve virtually anything, but it has to be done step by step at the level that the patient can handle it over a period of time. I give people an understanding of, I said, if you've had a chronic problem of any kind, no matter what it is, it usually takes, if you do everything the right way, it's 3 to 5 weeks for every year that you've had the chronic problem. So if you had something 20 years that's slowly been coming about, not necessarily the symptoms, because symptoms will come and go in the early stages, but if you go back and you try to find out when it first happened, you can, and if you do everything you should, you can do three times all those years. Maybe it's 20 years. That's 60 weeks. It's going to take a year and a half for your body. If you do everything the right way, the body will forgive you as long as you're breathing and as long as it begins to, produce more cells. But the problem is, and that in Western medicine, going back to what I said early on, we want it done yesterday, not, we don't want to wait. We don't want to have to change the way we think. We don't want to change the way we eat. We don't want to change the way we move. And in Chinese medicine, you take all those things together.
Yes. So I don't blame it. So same thing again. So I know a lot of Western medicine doctors here, not in the US, but also in China too. They're very against Chinese medicine, very against this medicine, or everything else is voodoo, whatever it is. So I think, I mean, I was a doctor before in China. So I don't against anybody. I don't against any medicine. Even medicine is there for a long time. There's a reason. There's a reason for every medicine. So it works for some way. So Chinese medicine is very, very, it's just like the very broad way, just like the Buddhists to love everybody, to support you from every angle. So no matter how sick you are, no matter how sick you are, we always can find something behind that. Because we know the connection, we know the body better as a whole picture. and compare the other doctors see only one piece. So I'll give another example, high blood pressure. So you went to the doctor gives you the medicine to lower down beta blockers, but I feel better for a while, and then the still go high, and then change the dose. By the way, high blood pressure medicine, there's a tons of high blood pressure medicine. So sometimes, I don't know here, but in China, a lot of my Western medicine doctor colleagues are always confused. They're confused too. They say, let's try this one, try this one. So this, and the end, okay, nothing works very well, not balanced very well, they refer to us. Now we see the body, as I'm saying, we see the body from the whole picture. We check the liver, check the kidney function. We improve the liver, improve kidney function.
Let's get back into that a little bit more. This is so fascinating. I could sit and talk to you for hours. We're coming up to a break. We have to say thank you to the people who bring you Dr. Tom Roselle Live. But don't go away. We have a whole lot more. And this Wednesday evening, the 29th, your opportunity to really get this and understand it. We'll be right back after these messages.
News Talk 105.9
WMAL.
Welcome back, everybody. Dr. Tom Roselle here. You're listening to Dr. Tom Roselle Live, as you do every Sunday at high noon on the Eastern Seaboard. We're here for you. We're here bringing you the best information possible so you can help yourself stay strong, get better, and live long. And that's the entire reason that we do this. Dr. Zhang, welcome back. This Wednesday evening, you're going to be putting together a program that is, fascinating. It's incredible. Our listeners really need to take advantage of being there with you because, number one, they're going to walk away with a lot of different information. And secondly, they get to understand what really takes place within the body. So let's talk about, that piece. Do people have responsibility, or should they just let somebody else do it to them, whether it's Western medicine or whether it's Eastern medicine?
Oh, no. So you have responsibility. I told my patients, so the best doctor is yourself. It's yourself. Do not rely on anybody. So you should rely on yourself. So that's why when I treat a patient, why I say that, because this is your body. So you're responsible your choice. And also, let me say again, so the service I offer, the treatment I offer, no matter it's a chiropractic, or no matter detox, acupuncture, all these things. So this is used on you. So I also always give patients some tapes, bring home. You can do at home to prevent something. So actually, I think the best doctor has to have 3 prescriptions. The first prescription is the treatment you offer. The second prescription is the tape you bring home. And then the third one, you have to monitor to tell the patient to keep following up the patient. The patient sometimes, okay, I'll do it because I feel bad. I'll do it for 1 week, 2 weeks. And then after that, I feel so much better. I don't do it. That's why I always follow up you. So don't try to get rid of me. So I just always follow up to see how's everything going, to push you a little bit further, and to make sure you do my homework, make sure you do the tips I told you, make yourself better.
It's interesting how we as human beings want to ignore our responsibility, the things that we have done over a period of years to get ourselves into trouble. Oh, I didn't do that too much. I didn't do this too much. I didn't do that too much. But when you add together all those little things that we didn't do too much, now they become a lot of something, and it begins to cause the body to break down and not respond the way it was meant and designed to respond. Your body, as I said earlier in the program, is extremely forgiving, providing you take away the stresses, the structural, chemical, emotional stress pathways. And that's where you're so strong. You have that ability to look at both sides of the puzzle and give people information. This Wednesday night, the 29th, is an opportunity. Join us. Join Dr. Zhang and allow him to give you pieces of the puzzle that you may never have thought about before. We decided to do this for you, put this program together for you. Particularly in the world that we're in today, you need to know what you can do to help yourself. You need to know how these things work together. You need to have a platform that you can ask questions of somebody who really has it together. And this is your opportunity. This is the time, to really take control.
Yes.
How would you go ahead?
I can help if you come. Yes, I have a patient. I told them I can help you to make the right decision. Before making a decision, I will tell you what's going on there, and then after you know, you make a decision, I believe.
It's so important that we just don't say, well, I have a cold, so I'm going to go take whatever medication. You call up your friendly doctor. They're not bad people, but they've been instructed by the drug companies, if you have these symptoms, give this drug. And so many of the drugs today are immune suppressive drugs. They further down-regulate, make things worse in the body than trying to fix it. They get rid of the symptom temporarily. But, when you listen to television, and you see all these wonderful ads on television, these happy, smiley people. And then at the end, they said, if you've ever had or you have this, blah, 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 blah. And, oh, by the way, the side effects could be all these things and death, and you could die from it. Why in God's name would you not look at something that is more natural and effective and proven to work? Might take a little longer, but now you have your life back.
It works bad.
And people just don't understand that they have that responsibility, and even from the time you're if you have a family and you have young children, right? That's the time to train them instead of just giving them all kinds of junk and sugar and carbohydrates.
Interesting. I'm sorry. I feel so good.
Go ahead.
Excited. Sophia, actually, my daughter had a little fever last week. I feel said, I don't feel well. I fever. When he asked me, he said, Dad, can you treat me? Can you adjust me? Oh my God, okay, that's the way you treat a daughter, you treat a kid, to do the natural way. He tried to use the Chinese herb. I said, don't take any if I tell you. He tried to find some Chinese herb there.
Yeah, just remember to tell Sophia who gave her first adjustment when she was a little girl.
You, my master, you. 3 hours after birth, you just my daughter. I never forgot about that.
I was sitting home. You made my day. That was... I had a smile that I couldn't take off my face for over probably a year. And I was just thinking of that beautiful little child and the opportunity she had to be able to have no neurological interference and get her energy levels that were up and so forth. We're coming up to a break. Dr. Zhang, I'm excited for this Wednesday evening, and I hope everybody will join us. It's an opportunity to really understand both sides of it. We're coming up to a break. We'll be here next week with another program that I think that you'll be very impressed with. This is Dr. Roselle saying one thing. We do this for you only because we love you very much. Bye.
Bye.
Are you dental phobic? Do you neglect your dental health because of fear and anxiety? A beautiful smile begins with exceptional dental care, and you can trust in the expertise of Soft Touch Dental Care and Dr. Michael Chung. Soft Touch Dental Care is unlike any dentist office you'll ever experience. Their warm and welcoming environment is designed to soothe fears and anxiety the moment you arrive, and they're especially pleased to pamper their honored guest patients. Dr. Michael Chung is a professional and leading expert in all areas of comprehensive dentistry, including cosmetic, sedation, neuromuscular, TMJ, and implant dentistry. Offering state-of-the-art technology, Dr. Chung can give you the smile of your dreams. Arrange for a complimentary consultation today with Dr. Michael Chung and experience the expertise that makes Dr. Michael Chung so unique. Call 703-319-6990. That's 703-319-6990. Or visit bestinsmile.com. That's bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Combining Eastern and Western Medicine on Wednesday, June 29th at 7 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellcare.com. That's rosellcare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellcare.com. That's rosellcare.com.